gave me warfarin to be using. But I don't know the effect of the warfarin. Will stop. Or is a lifetime disease that I have to live with? They said I suffer from a TBC trauma.
From? What did they say you're suffering from?
Will the clot disappear with prolonged use of warfarin?
Okay. All right.
TBC.
Okay, thank you. I think I've got the gist of it.
I'm not sure if
He's talking about having a clot, and he was giving warfarin. You know what that is?
Yeah.
And he's asking if he's going to have this condition forever, or is it going to make the clots go?
Okay, I'm not sure what his doctors are treating him for, but warfarin is a drug that helps to thin out the blood. Okay.
Do they use that to sort of dissolve clots?
Is
there something like a medication that helps to clean out those clots that could cause a blockage?
Okay. If a clot has already been formed, or if there's a predisposition to having a clot, okay, there are drugs that can be given to make the blood thin and not be sluggish and thick and form a clot.
Okay, so could that
so
be
warfarin is one of the drugs.
At this time, could that be what he's being treated for?
So if he had a clot in his leg, although this is not the the context.
Okay, so this is not part of what we're talking about.
Yes, it's not part of it directly. But the fact that he's using warfarin puts him at risk of, if the warfarin which is supposed to thin out the blood, if he uses it, if he doesn't monitor himself well, he increases his own risk of bleeding in the brain.
Okay. Now, here's the thing. You said that this drug, let's not even mention the names, can help thin the blood to make it move better. That's supposed to be good if there are blockages, right? Or if there are clots.
Yeah, but
you are saying it's not good because the vessel could rupture. Does that mean you treat the two different types of strokes differently?
Okay.
Just before you answer that, I'm being told there's someone on the line. Hello.
Okay.
Hello, Taiwo.
Hello, this is Taiwo from Ikorodu.
Yeah, we can hear you, Taiwo.
Please, I want to ask from the doctor, when one is suffering from diabetes, what likely medicine can one use? Motilue. Hello? Hello?
Yes, we can hear you. What likely...
What likely medicine? Because when I go to the general hospital, if somebody recommends this drug today, another will recommend another one. And at times I find it difficult. My leg will be as if something is shocking me. And when I complain, they will recommend. And the other doctor will only say, you should be using your medicine. Well, what I'm trying to ask is that, where can I be referred to a specialist in diabetes, so that I will not get this thing of a stroke of a thing or blindness or whatsoever?
Okay, thank you very much, Taiwo. Taiwo is concerned because you mentioned diabetes as one of the risk factors, and she doesn't seem to be getting any help for it. They keep changing her medication. So what do you have to say to Taiwo?
Okay, well, Taiwo, I would like you to try to go to your doctor. Whenever they want to change your medication, try and find out why they are changing it, okay? You also need to try and, even this calling is a way of you being more enlightened and empowered. You need to try and also read about diabetes so that you can ask your healthcare provider more questions. And if you're not satisfied, or if your doctor or healthcare provider thinks that you need to see a specialized care, he can refer you to a diabetic doctor, okay? But pertaining to the other man, the man with...
taking something for the clot.
Taking something for the clot. You see, the treatments for the ischemic stroke differs from the treatment from hemorrhage. Some treatment for ischemic can worsen a hemorrhagic stroke. So that's why it's important to first know the type of stroke you have.
And you can only do that with your doctor.
Yes, you go and see your doctor. The doctor will examine you, and they will probably, they'll probably order a test called a computer tomographic scan. Okay, it will look into your brain using X-rays.
All right.
And
we have a phone call coming in again. They just keep coming on top of each other. Hello. Hello. We seem to have lost person.
Okay. Hello and good morning.
Hello and good morning. What's your question?
Hello, good morning. Good afternoon.
We can hear you.
Hello, good afternoon.
Good afternoon.
Good afternoon.
What's your question?
All right, my name is Oladimeji. I'm calling from Abuja.
Okay. Go on, Dimeji. Go on. Hello, Dimeji.
Yeah, doctor, please, is there a relationship between angina pectoris and stroke? And then what is the real treatment for angina?
Okay, thank you, Dimeji. This is a very educated Dimeji.
Okay.
Angina pectoris.
Okay.
Is it connected to stroke?
All right. I'll say yes and no.
Wait,
Okay.
angina first of all. That's the pain you get inside the chest, right?
So angina pectoris means chest pain.
Okay.
Okay, and it's referred to the chest pain that are caused due to an imbalance between the blood supply to the heart. And the energy and oxygen it consumes.
Okay.
So it occurs frequently as a result of a partial blockage of the blood vessel to the heart.
Okay, so this is to the heart, not to the brain.
Yes. So now the reason why I say yes is that the blood vessels to the heart are similar to the ones in the brain.
Okay.
So if somebody has hypertension, they're at risk of the high cholesterol, and then the high cholesterol can also partially block the blood vessels to the heart. Okay? And so the risks that happen to the heart could also happen to the brain. Okay? Right. So that's why they could also have a stroke as well.
Now, we're almost out of time.
Okay.
But I need to ask you one final question. If somebody does all these things, live a better life, eat well, exercise, stop smoking, don't take alcohol over much, and all those things, by approximately how much do you think the person can help himself to prevent a stroke?
It depends on how old the person is. But of course, like I told you, you can't do anything about
the non-modifiable.
But by doing all these things, you seriously reduce your risk of stroke. Just controlling your blood pressure, ensuring that your blood pressure is normal, you would have reduced it by multiple fold.
Wow.
Avoiding smoking, drinking, checking your heart. You just try to limit yourself to the things you can't do anything about.
So it's partially in our hands.
Yes.
And with that, we have to call an end to this. Thank you so much for coming. That has been wonderful.
Thank you.
Thank you for being with us. And please remember, most of it is in your hands. Thanks for being with us. I am Mary Alale Yusuf.